Hey Titanium teammates, it's Kristen from Action Potential, and today I'm going to talk about what to expect with a knee replacement. A lot of people worry about having their knee replaced because they're so fearful of the rehab afterwards, but I assure you that almost 99% of the people that I treat who have had a knee replacement report that the pain that they feel afterwards is significantly different and much more tolerable than the pain that they may have had before that knee replacement occurred. So things that you can expect after a knee replacement is certainly you're going to have a lot of joint swelling around the knee and below. In fact, some of that swelling can be so pronounced that it'll cause bruising down in the ankle and the foot, which is very normal. There's certainly a lot of ways to control that swelling, the most important being finding time throughout the day to elevate that leg. The next thing that you can expect is definitely some pain. That pain is usually controlled with medication prescribed by your surgeon, as well as it helps to have physical therapy to help guide you through that pain and minimize the pain. So keeping the leg moving will not only help reduce the swelling, but will also help reduce the pain. A lot of people think that moving is going to actually make it worse, and that is indeed not the case. We work really hard in physical therapy to get you off of opioid pain medication very, very quickly, since it does have a highly addictive quality, and instead shift to either non-pharmacological medications that are over the counter or a completely non-pharmacological using things like ice, movement, and elevation. In your initial appointment after your joint replacement, it'll be a very basic session where the therapist will just look at how much you can bend your knee, how strong your leg is, and how you're doing with things like walking and stairs. And then in the subsequent sessions, a lot of the emphasis will be on helping to restore the normal movement of the knee, as well as progress the ability to walk from maybe using a walker to a cane to no device at all. A lot of people think that the rehab is going to be extraordinarily painful. And what I always tell my patients is that when you are having your knee stretched or moved by the therapist, you should feel in control of that pain the entire time. Meaning the therapist should not be cranking on your knee and you're crying or biting on a towel to help control the pain. You should be in communication constantly with your therapist to make sure that the flexibility and the stretching that you're experiencing is tolerable and that you're in control of it. Because if not, that therapist is just pushing against and you're pushing back, and really you're not getting anywhere with that stretch. So I like to advise people about this early on because it does help to mitigate the fear component, because no therapist should really be in there cranking on your knee and making you scream out loud. You should feel controlled and then as a result have a significantly improved recovery. Knee replacement is definitely something that requires a lot of thought. I encourage you to get a couple opinions prior to deciding on a surgeon, as well as I encourage you to consult with a physical therapist prior to the surgery so that they can give you some tips for things like early return home, as well as maybe some exercises that you could think about right away to help improve your recovery. So certainly if you have any questions, reach out, and if you are undergoing surgery, best of luck. I can assure you, knowing personally with my mom having had it done, most people are extraordinarily pleased with the outcomes, and it helps them restore a quality of life that they hadn't had in a couple years because of pain.